this is your Houston chiropractor, Dr. Gregory Johnson. We got Dr. Sonny Tuft here with us this week for Advanced Chiropractic Seminar. And Dr. Sonny is from Farmington, New Mexico.
Farmington, Utah.
Farmington, Utah, excuse me. And he's close to Salt Lake City. And he's going to be doing the ring dinger on patients out there in Utah and the Northwest Territories, right?
Absolutely.
Because you got people coming to see you from out of state already.
Absolutely, yes.
And then the nearest airport is Salt Lake City?
Salt Lake City, we're about 20 minutes away from Salt Lake City Airport.
What's the name of your practice again?
Cornerstone Healing.
Okay, and your website address, if you know that?
CornerstoneHealingUtah.com. Our phone number is 801-451-6010. As soon as I get back, we'll get that table going. It's already delivered and we're ready to go.
He was smart. He actually purchased the table before he came for the seminar. So now he can go back home and start putting into practice exactly what he's learned here this week. And tell him a little bit about the seminar, Doc, what you learned this week in this seminar versus a lot of the other chiropractic seminars where you go sit behind a chair and desk to watch a PowerPoint
One of the biggest things that I've loved about the seminar is it's hands-on. We're actually seeing you with patients, real life things. It's we're not talking theory. There's been not much theory talked about. We're actually dealing with patients, watching you, how you deal with them, how you talk with them, the contraindications, find out who's the best patients for this, and then actually delivering a great, powerful adjustment and how it's affecting the nervous system and the brain and retraining them to hold that adjustment and to hold better posture and to start healing.
Right. And what would you tell chiropractors who are watching this about the safety and efficacy of this technique after you've been here and learned about all the safety protocols we have in place?
You know, it's amazing. I'll be honest, I was a little nervous to come, and I've seen the YouTube videos and I wondered about it. I met someone that's doing the technique. I hadn't had it done yet. But talking to him made me feel comfortable. I said, okay, there's no one in Utah doing this. I have patients leaving, flying out, going somewhere else to do it. So I decided to come here. But I was a little nervous and hesitant. As I came though, the neurology that we talk about, the orthopedics, all that stuff, and what it's doing to the brain is just amazing. And once I received my first ring dinger last night, I felt really good. Amazing. It was the tension in my back, the tension in my legs, tension in my neck, my low back kind of just disappeared and went away. That decompression feeling,
it's almost indescribable.
Exactly. It's amazing. It's a powerful adjustment. Get things moving. It changes. I'm excited to get the changes going.
Yeah. And you know, there's so many chiropractors out there that dog this, saying it's causing stroke. I mean, what's the number one thing that we teach you guys about ruling out contraindications?
The contraindications, absolutely.
Which are spontaneous cervical artery dissection of the carotid vertebral arteries.
Yep, absolutely.
And what symptoms and signs to look for to make sure you're recognizing those patients and to make the appropriate referrals to a ER where you live to make sure that they're checked out for that.
Right, absolutely.
So I think we go well above and beyond what most chiropractors do in our histories and exams to rule out contraindications, wouldn't you think?
Yeah, absolutely.
Yeah. So he did his very first one on Dr. Went here a little while ago, and that went great. He did a good job. And I'm going to do his now, and then he's going to do me this afternoon. So
sounds great.
Okay, you're up. Let's check his posture first. Let's go forward and backwards for me, please, Dr. Tuft. Okay, he's a little forward and a little right. That's kind of his pattern. That's probably how he's been sleeping most of his life. Pelvis is a little bit right translation. Not bad, though. So we're going to do the ring dinger first since he's already had one. A little less apprehensive today.
It's excitement now.
Yeah. And I asked him this morning when he first came in, I said, are you sore yet? No.
No. I actually had no soreness.
Yeah. And we always advise our patients that they're probably going to feel some soreness for up to 72 hours following this adjustment. Slide down just a tad, doctor. Yep. Yeah, you might be here all week with that pin in.
Holy cow.
All right. Keep your teeth together. Don't bite your tongue. Breathe through your nose. Yes, sir. Oh, man.
Those were tight.
Yeah. See, that's the amount of force that was in that one.
Wow.
But that force is dissipated through your entire spine, which is surrounded by ligaments, front, back, side, plus the disc, which is the strongest ligaments in our body. to the left. Yep. There you go. I didn't have to do, he's still kicking with him because he is still kicking. Yep. Okay, let's go over here on your tummy next. You know, some chiropractors will say, yeah, he does the same adjustment on everybody no matter what their condition. And that is true. Because we don't adjust specifically like L5 or C5 like a lot of non-stent chiropractors do. But the specific intention of all of our adjustments is to elicit a biomechanical change in the segments that we're adjusting that stimulate mechanoreceptors, which are fired off afferently into the cerebellum and cerebral cortex, changing brain plasticity, which is known as neuroplasticity. Because you only experience pain in your brain. So our intention of firing off as many afferent proprioceptive impulses into the cerebellum and the cerebral cortex is on purpose to override the current neurophysiology that's developed in that patient's brain. Slide down this way about an inch down. There you go. Yeah, much better when it drops. Thank you, Tracy. There we go. Okay, let's go on your back. Yep, slide down just a tad. Get those arms out. There you go. You can relax your hands right there now. Yes, sir. There, good. Okay, let's sit you up face that way. Yep. See that little internal rotation opens that little humeral up. There you go. Yep. Yep. All right, let's come over here, shoot you down. You're ready to go. Gotta make sure he's all tuned up before you did my adjustment. Feel the range of motion improving in your neck right now?
Yes.
This is not a ray gun. It has a specific purpose too. Sort of up back. Yes, sir. Good. Perfect. Okay, try that again.
That's great.
Doesn't that feel good?
It does.
How would you describe the feeling of these adjustments to our colleagues out there who have been wondering about this technique?
There's no pain. I was nervous. I'd blown out a disc, my L5S1, and I know yesterday with standing and watching you work with the patients, my low back started to tighten up. So I was a little nervous with actually, doing the lumbar adjustments this way, and then that decompression, the ring dinger. But it was nothing. It was great. It felt wonderful. And
Would you have any apprehension to
No, today.
any patients with a severe herniated disc? Or
No.
radiculopathies now?
No problems.
As long as you rule out those pathologies and the
Absolutely.
contraindications.
We determine it's safe for them, and I love it. I mean, on a good note, me having a herniated disc, I've had that experience. I've had the shooting down where I couldn't walk all the way down to the leg.
Usually from that lateral lumbar roll.
And so, with having that, I know what patients are starting to go through, and I can walk them through that now.
That's good.
With me having that.
Well, he's been doing a great job. Him and Dr. Hugh Bennett from Virginia this week, and if you see Ring Dinger or Team Ring Dinger on their website or their videos, you can bet that they have been through the mill-in training, histories, exams, everything, biophysics, adjustment parameters, vectors, line of drive, contact points, everything. And they have to be able to do it on me and Tristan effectively before we pass them too. So far these guys are doing great. We got one more day, today and tomorrow, that we're finishing up here. But if you have any questions on it, go to our website at advancedchiropracticequipmentllc.com and you can fill out a request form and sign up for the seminar and learn more about it. This is your Houston chiropractor, Dr. Gregory Johnson, and this is
Dr. Sonny Tuft from Farmington, Utah.
There you go. I'm glad you didn't ask me because I was in New Mexico again. We'll see y'all soon for your Ring Dinger.